you have a lot of Tele-ICU programs. What are these? What are these different programs all about? There's Sepsis Management Program.
Well, the EICU was started again in 2006 in our health system, and it really became a center for the development of a number of telehealth projects within our system. In 2009, we started something called the Transfer Center, which I think they talked about on last week's show a little bit. So it used to be that when a nurse or a patient needed to be transferred from one facility to another, there was no regularized process. Now they call that Transfer Center, and the Transfer Center will find a hospital, find a doctor, get the doctors at the sending and receiving facility on the same line to talk to each other, and it's a recorded line. Arrange for the exchange of the medical information and also the transfer of the records and the transfer of the patient. We also have a Telestroke Program, whereby if a patient presents to the emergency room with stroke-type symptoms, we can get a neurologist using a telemedicine system to see them and evaluate them right away. And these kinds of systems are used not just in Baptist, but throughout the country now, and are found to be much more effective and more efficient and better at delivering care for stroke patients because they can get to the neurologist and the CT scan much sooner and make decisions about whether the patient's a candidate for the clot-busting drugs. And then we have a Telepharmacy System whereby our pharmacists can communicate with patients after they've been discharged home to make sure that they're getting the right medications and they're not taking duplicate medications. You know, patients are often confused by the fact that maybe they had the generic name medicine at home and they were discharged home with a branded name. For instance, a diuretic generic name like furosemide maybe was in their medicine cabinet at home, and then when they were discharged they were given the branded drug Lasix, and they get home and don't realize that that's really the same medication. So the telepharmacist can kind of sort out those things and answer questions for the patient about how they should be taking their medicines to make sure that they're taking the right ones.